looking at operating the guidelines safely within your nurseries with a focus on guidelines numbers 4 to 9. So this is the second part for nursery staff. Quick recap on the training process for everybody. Everybody is on mute tonight. We've done this to enhance the listening experience for all attendees. Rafi has just mentioned that at the top of the screen there is a chat function called Q&A. If you do have questions, please post it here. Before you write your question, please make sure that you do notify us of which licensing authority you're falling under so that we're able to direct your questions to the right people. Unfortunately, if you raise your hand tonight during the session, we won't be able to answer your questions. We're not able to answer questions live. All questions that you do have to be put to the licensing authority. So we're not being rude, we're just not allowed to answer those questions for you. I've put on the bottom of the slide the Kinderly website for you. Rafi did just mention it again, but do go and visit that website. There is a lot of information on there that will help you. There is a soft copy of the guidelines and all of the reopening documents for you to go through. So take your time to go through those. There's also the frequently asked questions document. Again, a lot of the questions that you may have could have already been asked, and therefore they will have been answered, and the answers will have been put on that frequently asked questions document. It is updated really regularly, so do take time to go over there and have a look. At the end of the 2 parts of the course, you will receive a code, as Rafi has just mentioned, and that is the assessment part of this course. And you do need to complete that assessment. And as Rafi's mentioned, you will be getting certificated on completion of it. And you do need to retain copies of that within your setting for the reopening process. And finally, the sessions are being recorded and the recordings are available 24 hours after the session has been delivered. And there will also be translations of these available in Tagalog and Hindi. So tonight's session is looking at the guidelines 4 to 9 of the reopening document. And we're also looking at the roles and responsibilities in relation to guidelines numbers 4 to 9. I do need to just mention here that this training course is not in place of reading the guidelines. It is expected and it is your responsibility to go away and have read the guidelines and to have read the roles and responsibilities and be clear on the roles and responsibilities that pertain to you and your job within the nursery and ultimately what those guidelines mean for you. Different nurseries will be interpreting these guidelines slightly differently, so you do need to go back and speak to your nursery leadership and understand exactly what is expected of you in light of your nursery's interpretation of the guidelines. And then if you have any questions, it's important that you do get clarification on anything that you're unsure of. So again, go back to your nursery leadership, your principals, your nursery owners, and get the answers that you feel that you need before we start to reopen. By the end of today's session, it is anticipated that you will have a clearer understanding of the guidelines and ultimately your roles and responsibilities within it. And through the session tonight, we will give some practical advice and some ideas for you to look at how you could implement these within your setting. Again, supporting your leadership, supporting your principals, and making sure that together you move forward as a team to ensure the safety of the children, the staff, and ultimately the parents and families as well that are within your setting. I can see that hands are continuing to be raised. Can I just say we are not being rude, but we are not able to answer your questions live. So if you've raised your hands, I'm sorry, I can't answer your questions. If you have a question, you do need to put it into the chat function at the top of your screen because all questions do have to go to the licensing authority for answering. Just remember, before you put your question, do put which licensing authority that you fall under. And here is an overview of tonight's learning outcomes. We hope, again, familiarity, guidelines 4 to 9, making sure that children are kept safe. That really is important moving forward, that you're going to have practical knowledge on implementing these guidelines, and that obviously it's all about working as a team now. We really are in this together, and the success of our nurseries and the reopening is reliant on how everybody within the team works together to implement these guidelines. So here are the 9 guidelines. Just a quick reminder, we are looking at guidelines numbers 4 to 9 tonight. There are 5 documents, as I mentioned in part 1. The documents that you really need to be looking at are the operating guidelines themselves and also the roles and responsibilities document. In addition to that, there is a self-assessment form which your nursery leadership will be completing prior to reopening, and that's required to be uploaded for them to get their NOC. There's also a reopening plan manual and a reopening plan template. Again, those documents really are for your nursery leadership to be completing and uploading for their NOC, but just so you're aware of the documentation. Either go and ask your nursery leadership to give you copies, or the copies are available on the Kinderly website. So again, you can go and access it there. And it is your responsibility to make sure that you have read the guidelines, you've read the roles and responsibilities, and that you understand them. So guideline number 4 is social distancing, and within this there are roles and responsibilities for nursery staff and for cleaners. The first thing to be aware of is the new bubbling system. We will be putting all of the staff into bubbles, and ultimately the bubbles, the children and staff in each bubble should not mix or intermingle with the staff and children from another bubble. So it really is important that the integrity of those bubbles is maintained at all times. If you're working with children from 45 days to 2 years of age, it's possible that 16 children may be registered to your bubble, but only 8 of them will attend on a day. And the staffing for that bubble is 1 nursery supervisor, so that's a teacher, or 1 nursery supervisor assistant, so an assistant teacher, and with that 1 nanny and an extra staff member needs to be assigned as well. If you work with children aged 2 to 4 years of age, up to 20 children can be registered to your bubble. So that means obviously that you could have part-timers and have a combination of part-time days. On any one day, 10 children can attend, and the staffing for that would be 1 nursery supervisor, so that's a teacher, and 1 nursery supervisor assistant, that's a teaching assistant, and an extra staff member needs to be assigned as well. So that is what the bubbles will look like within your nursery, and it is important that throughout the day that bubble stays intact and that everything you do is within your bubble space. So that's really important. So eating and sleeping, again, within your bubble to ensure that it remains intact for the duration of the day. As I just mentioned, each bubble will have a lead teacher. That would either be a nursery supervisor, so a teacher, or a nursery supervisor assistant, an assistant teacher. In addition to that, they have a nanny and 1 extra staff member. It is important that when these clusters or bubbles, are put together, that they are put together with qualified staff. We have to have ratios maintained with qualified staff. So that really is something that's very important here. And when you have an extra staff member, you need to identify how they're going to be used. Will you use them as a runner? So going and collecting the children from the parents at the door of the nursery, making sure they've gone through the sanitisation process, the daily health check, and that they are then dropped to the classroom door. Once all the children are in for the day, a good use of that person then is to make sure that the toys and resources are cleaned and sterilised as they're used. But again, every nursery will have their own approach to this. As we move forward as well, it's really important that as you're preparing your parents and communicating information out to them, that we do remind parents that at the moment we are unable to have any pushchairs, scooters, bikes, car seats on our premises for the time being while these restrictions are in place. Also within the bubble system, it is important that the cleaner is also assigned to bubbles. and again that those are maintained intact. There's no intermingling. If you have a cleaner that's assigned to common areas such as your corridors, receptions, etc., that's a good use of somebody to ensure the cleanliness of those communal spaces. Again, making sure that there's an awareness of the touch points and that those touch points are sanitized and cleaned regularly. So that's hourly or after each use. It is important that within your bubbles as well, there is social distancing taking place, and also between the staff from different bubbles. Throughout the day, as you're working within your teams, you need to think about how you're going to manage areas such as your transitions. If you're moving up and down stairs or in corridors, again, making sure that those bubbles do not come in contact with other bubbles. So it may mean that you have to go to your classroom or move to a communal area and then phone to say that you're back in your room so that the next bubble can be moved around the nursery. If you are going up and down stairs or there is an area that has a handrail, make sure that before you move your bubble, you're cleaning the handrail before and after the children are moving along it. You will also need to have in place in your settings a schedule for communal areas. And it's important that once a bubble has used a communal area, it is cleaned and sanitized, and then it's left for 24 hours before it is used by the next bubble. So again, planning the use of the communal areas for each of the bubbles is really important. Work with your setting leadership to ensure that there is a good use of those communal spaces, but also taking into account those precautions for cleaning and sanitizing in between and that 24-hour gap. Again, look at your classroom environment. It's really important that we make sure the children spread out throughout the room, and there really should be no more than 4 children working in an area. If you have your furniture all around the outside of the classroom, what tends to happen is the children all go into the middle. It's kind of finding safety in numbers almost. So again, use the furniture in your room to break it into smaller areas that individuals or small groups can go and work in and feel safe in. And think about the layout. That's really going to be important for ensuring your social distancing as far as is possible with children of our age group. So sit down and take time with your bubble team to look at the layouts of your classrooms and think about how that would allow children to work in those smaller groups and ultimately be at social distancing from others. Moving on to guideline number 5. This is all about staff and child sick leave and attendance. And here it's important that there are roles and responsibilities for the nursery staff and also the school nurse. It's at this point that we do have to highlight that our job is really like no other job in the world. And at the moment, more than ever, staff attendance, if they are fit to be at work, is ultimately so important. We do need to be there, and we do need to be able to be relied upon by our setting leadership, by the children, and ultimately the other members of our bubble team, because that consistency is going to be so important in getting this right. However, if you are not feeling very well, or if you have signs and symptoms of an illness, you are not to go to work. It is really, really important that you stay at home and you go and seek medical advice straight away. If you are going to be absent, please do try and give your leadership or your HR manager as much warning as possible, because obviously at the moment organising cover for these bubbles is going to be very, very challenging, and making sure that we have extra staff that can be assigned to the bubble, because once somebody has been given to a bubble, they cannot be able to work in another bubble. So it really is important that we have time to be able to plan this if that's possible. Once you have said that you are unwell, you do need to go straight to the doctors, and you do need to get a diagnosis of what is wrong with you. Obviously, if it's COVID, there is a certain procedure that needs to be followed. You need to contact your school nurse and your principal, and you need to inform them of this, because there's certain measures that they need to take. If you have a diagnosis that's non-COVID, it is also still important that you contact your nurse and you let them know what's wrong. The nurses will be responsible for monitoring trends in sickness within the nurseries, and obviously they need the information to come to them to be able to monitor that. So again, if you're not well, you need to go straight to the doctors, you need to get that gut diagnosis, and you need to feed that back to the nurse and the nursery leadership so that they're able to manage the situation appropriately. If you become unwell on site, again, a similar process is in place. If it is deemed that you have signs and symptoms of COVID, you will be moved to the isolation room that is in place, and you will need to be going to get doctor's medical attention as quickly as possible. Again, to minimise the time that you're on site and that you could be giving that to other people. So again, you're going to be asked to go straight to the doctors and go and get a diagnosis, and that needs to be fed straight back to the school nurse and the leadership, as they do have principles that they have to follow in line with MOHAP's guidelines. And so they have to report it, and then there's obviously a chain of follow-up that needs to happen in regards to the nursery. If it is non-COVID, they also need to, the doctor also needs to be giving you information on when you should be returning to work. Are you having a sickness certificate? Are you well enough to return? All of that information also needs to be fed back into your nurse and also your setting leadership. If a member of your family is unwell, it's important that you also contact your school nurse, because they will advise you as to whether you are safe to come to work or not. At the moment, you may have noticed that your school nurse really does become quite pivotal in the operations of the nurseries. So again, please make sure that you go and speak to your school nurse on the telephone and ask them their feedback as to whether you're able to come to work or not. It really is important at the moment and a moral and legal duty to disclose if you are feeling unwell or if you have come into contact with somebody that has COVID-19. Non-compliance with this is completely unacceptable, and obviously it's important to everybody's health and safety. We are transparent at the moment and we are honest. Failure to be honest and failure to disclose is punishable by fines and also a jail sentence. So please keep that information in mind. And again, have lots of conversations with your nurse, keep them updated on things. Again, just to make sure that you're safe and the children are kept safe. At the moment, if you're planning to travel, it really is important that you speak to your nursery leadership. Settings may have policies and procedures in place with regards to travel and the continuity of the workforce, because obviously managing this bubble system, if we've got people going off on leave, is going to be very, very tricky with a reduced staff. So do go and have conversations with them if you are planning to travel. Ultimately, your nursery leadership, the principal, owner, head teacher, do have a responsibility to all staff members to ensure their health and safety. So again, they will have their own processes and procedures to be followed there. If you are given permission to travel, it's also important that you take into account that on return you will require a negative PCR test and you will have to comply with any current quarantine practices. So at the moment, that is a home quarantine for 14 days. So you would have to build that time into your annual leave, obviously, if you've got plans to go anywhere and your nursery leadership are happy for you to do so. At the moment, it's really important that we are very clear with parents as to when their children can attend and when they cannot. Children must not come into the nursery if they have been around anyone who has tested positive for COVID-19. If they themselves are unwell, they shouldn't be on the nursery site. They shouldn't be being given any medicine before coming to nursery that may mask the symptoms of illness. So they shouldn't be being given Brufen or Panadol before coming to nursery because obviously at the moment we are monitoring temperatures and we are looking for those signs and symptoms, and by masking it they could take away an important indicator for us. What we are suggesting is adding onto the forms some kind of information that they would sign to say they understand and acknowledge that if they have any of these situations, or they find that their child is in any of these situations, they don't come to school. And therefore, if the parent has signed to say that they understand they can't bring them under these conditions, you just have another backup in place. Parents also need to understand that if their child isn't well, they do need to make contact with the nurse and they do need to keep her updated. They will be asked to go straight to the doctors, and they will need to get a doctor's diagnosis that they then feed back to the nurse. Again, as we'll be monitoring those trends within our nurseries, it's important that the nurse has all of this information to be able to do so. When it comes to staff and child attendance, these measures do need to be strictly adhered to. And it's important that, as well as us understanding the importance of this, that we need to convey this to parents, because ultimately we need the parents to support us in this, to keep our nurseries as safe and healthy places. We can do as much as we can do, but we ultimately now need the parents to do their part as well. So being clear on our expectations of parents in advance, so that they are fully aware of what returning to nursery will mean for them, is really important as well. So again, if you're a nursery teacher and you're planning on having information sessions with parents before you open, build this information into those sessions so that you are very clear with them from the start of what you're expecting from them. And throughout the day then, it really is a vital part of the bubble team's jobs to make sure that they do watch the children and they are looking for signs and symptoms of any illness or the child not being quite themselves. Something that we're doing in our nurseries is we've actually issued the teachers with thermometers, and we will have the nurse taking temperatures on arrival, and then one of our teachers in that bubble will then be responsible for taking the children's temperatures halfway through the session. Again, that just means that the nurse isn't going in and out of bubbles and between bubbles, and it just ensures that that bubble remains intact. Obviously, if there was an emergency or we needed her to come in, she would be able to go into those bubbles. She's a medical professional. She understands the requirements and the importance of ensuring that there is no cross-contamination. But ultimately, it just means that for taking temperature's sake and for monitoring that for the nurse, a teacher is very capable of doing that too, and she'll just record it and then submit that information to the nurse. So again, by monitoring those temperatures regularly, we're just keeping on top of things. The teachers will also, again in my nursery, be taking temperatures as the children leave the session at the end of the day. So we have a complete record of taking that temperature and monitoring it. Also, we will be placing a small first aid kit within our bubbles. I'm sure that most nurseries here, it is a requirement of compliance, do have first aid trained staff. I know I certainly do, and we have actually allocated those to the bubbles accordingly. And as such, they are capable of dealing with minor first aid. So we will be providing them with a small first aid kit. And obviously, if there is an incident, they will notify the nurse. But if it's minor, they can then deal with it within the bubbles. And again, it's maintaining that integrity of the bubbles. If there's a slightly larger incident, like a head bump, for example, then obviously, if you deem it important the nurse is involved, then she gets involved. And again, that's just processed as it would normally be on site. But again, just making sure that those bubbles, as much as possible, do remain intact, and we're limiting the movement into and out of those bubbles as much as possible. So again, just think about what you could put in that first aid kit and how you would inform your bubble team as to what's minor and what's slightly bigger that may need the nurse, just so again you have the clarity on that. Moving forward, something you need to be aware of is that all staff and all parents must have downloaded the Al Hosn app on their phones. Again, the link is there for you. As a staff member, it's our responsibility to do this and make sure that we have it all logged in. We're also needing the parents to do the same. So again, if you're having parent sessions, that's something you may wish to communicate to the parents. I am sure that your setting leadership will have in place information for parents to download this. In addition to having this downloaded, again, something we're doing in our nurseries is just adding something on the bottom of our registration forms that, again, parents will sign to say they confirm they have downloaded the Al Hosn app. That's just our way of making sure that we have notified every parent and that they have confirmed that they've done it. And that's all we can do, is make sure that we've informed them and that we've got them to confirm that they have, in fact, done as we've asked them to. Another requirement moving forward is that nurseries will have in place an isolation room, and the isolation room needs to be a separate room to the clinic. If a child or a staff member is identified as having signs and symptoms of COVID-19, they will be moved immediately to the isolation room, and then somebody will be sitting with the child, a familiar adult, in full PPE suit, and await the child to be collected. One of the requirements of the guidelines is that the child will be collected within the hour of parents being notified. So again, at our nursery, we're making sure that within our registration process, we have written down that the parents understand that this is a requirement that we're making, and that they confirm that they will comply with this requirement should they have to do so. So again, that's just something to keep in mind. Ultimately, any cleaning of the isolation room after it's been used is the responsibility of the nurse, and she will ensure that that's completed before use. If there is a second case identified, obviously there would need to be a second isolation room available. But again, your nursery leadership will be able to confirm all of this information and tell you exactly where those spaces are, so that you're aware and understand how this is being complied with in your nursery. As I just said, that parents do need to come and collect their child within the hour if they are contacted. So that really is important. And the nurse is responsible for telling the parents that they do need to take the child straight to the hospital. They are not to return to the nursery until they have a negative PCR test, if it is deemed to have been a possible case. So again, read through the guidelines. The guidelines are very, very clear that if it's a positive case, this must happen. If the test result is negative, but the clinical diagnosis is COVID, then there's another process that needs to be followed. So again, read through the guidelines so that you understand exactly what will happen and what course of action will be taken at what time. And that's important moving forward, that you understand that. Here you go. If the patient has a negative PCR test, clinical assessment of a probable case, they have to complete a 14-day quarantine. If it's a negative test and there is no clinical assessment of a probable COVID-19 case, the child or staff member can return to work as soon as they are symptom-free, in line with your settings policy. What this means is that most settings do say that a child or an adult needs to be symptom-free for 24 hours before returning. So again, that would apply here. If the PCR test comes back and it's positive, then the nursery will be closed immediately. And this is why it's so important that we do explain to parents the responsibility that they have in ensuring that if their children are unwell, they keep them home, and that they comply with all of the measures that we have in place to make sure our nurseries stay safe spaces. Again, if that positive test result comes back, traced contacts, so that's staff, classmates and colleagues, will all be notified, and they will all be put into a quarantine of some description, 14 days, and then they will need to have a clearance certificate from the Department of Health to say that they've been cleared from isolation before they are able to return to the nursery. Again, all of that information is within the guidelines, so take some time to read through it and understand those requirements. If there is an emergency within the setting, the necessary guidelines must be followed. And within your nurseries, there should be sets of full PPE available should it be required. And also your setting will have designated a health and safety officer. So again, make sure that you've spoken to your setting leadership, or within the training that they're giving you, they have identified to you exactly who that designated health and safety officer is, so that you know who you're dealing with, and you can go and seek advice from them as well if you need any clarity. I think within most nurseries, that's most likely going to be the nurse, but some nurseries may have decided to implement it slightly differently. So that really concludes the sick leave and child attendance side of things. Guideline 6 is all around crisis management. So moving forward, every nursery does need to have a crisis management plan in place. This is developed really as part of the reopening documentation. It is a really good document to have in place because it means that staff can go and take time to read through it and understand what needs to happen in case of an emergency and what kind of responses are expected from them. Your nursery leadership, again, may take time to go through that, and they may carry out, before you reopen, training on it, or during the next few weeks and months they may introduce you to the sections of it, so that you're given information in a manageable manner rather than overwhelming you, because we've got so much information to take into account as we reopen under these new norms. So again, just take time to work through that. A number of the policies and procedures may have been adjusted to take into account the current situation, the current pandemic that we are in. So again, just taking time to understand any documentation that they've put in place there. At the moment, obviously more than ever, it's important that your principal has all of your contact details. They are responsible to putting together contact lists at the moment, and part of that, obviously for contact tracing, will be to ensure that they have all the details that they need to be able to get hold of you. And within this, they will need your current Emirates ID number. So just make sure that your settings have all of that information. You will also be requested to submit to them your emergency contact details. That's for obvious reasons. Should you become unwell on site, they do need to know who to contact. I would strongly suggest that you can give them 2 sets of details, so that if one person isn't available, they are able to find somebody else to contact for you. They will also be requesting information on your living arrangements. Again, this is a requirement of the guidelines, so you do need to provide them with this information. And lastly, they will be looking at personal health. So you do need to provide them with information on your health. And again, this is just to look at the eligibility of staff within the setting. So again, take time to read the guidelines and you'll see exactly why they're requesting that information. It is within the guidelines. They're looking to see if anybody is high risk, and if they are high risk, again, how they can work with you to mitigate that risk. So making sure they have good information is really important for your health and safety. If we were to go back into lockdown again, it's important that you understand and are capable to work from home should you be required to. The last few months, some nurseries obviously have been doing a lot of work on online learning and putting together their expectations of what online learning looks like. So again, if that's something that your nursery is doing, do you understand the software systems that they use to support that? So now is a time perhaps to look at things like Microsoft Teams, Zoom, WebEx, or any nursery management software that again supports that online home learning, so you have an understanding of it. In the next few weeks and months ahead, if you have a company laptop, again, we strongly suggest that you carry that backwards and forwards to home every day, so you have it with you should you need it. And again, the same goes to be said if you have a company iPad that you use within the nursery, so that you have all the information with you should anything happen and we need to go into lockdown again. Within my nursery, something we're looking at as well is putting kits together for our teachers and our TAs, because one of the things that we struggled with was a quick move to online learning because some of the staff just didn't have the resources that they need. So we're putting together small kits of paint, paintbrushes, glue sticks, and even things like storybooks that are age and stage appropriate for the age groups that we work with, so that if we did need to go back onto online learning, you have those kits ready and you can do so at speed. Really here it's a case at the moment of being as proactive as we can, so that should we ever need to work remotely, we are able to do so. Your principal should be putting together your crisis management plan, and they should be working with members of the team to do so. Again, make sure that you support them in this. There's work that needs to be done. Policies and procedures need to be reviewed. Perhaps some new ones need to be made. Again, see how you can support this within your settings. And if they come to you and they need you to read through policies and procedures, be ready to provide feedback and looking at ways of making things manageable within the settings. We're going to have a lot of new requirements that we have to comply with, and obviously finding a workable and manageable solution in each setting is really, really important. So again, supporting your nursery leadership to ensure that you're working with them to get those measures into place. As they put together their crisis management plan, there'll be a number of roles that they'll be looking for people to fill. Again, this is just some suggested areas and some suggested roles. Your nursery may have different roles and different responsibilities, but again, making sure that you're aware that if there are roles out there and perhaps there's something that you would like to volunteer to be a part of, if this is an area of interest. The crisis management plan will look at 3 different areas. It will look at the planning that is done before an emergency or crisis happens. Then it will look at all the different things that have to happen during that emergency. So if we look at our current pandemic, during emergency would obviously be that period of lockdown that we've had. And then finally, the post-emergency roles and responsibilities. And this is where we are now. We are now getting ready to reopen and return to our businesses. And so we're in that phase at the moment. So again, looking at ways that you can help support them with that. Moving on to guideline number 7, this guideline looks at the positive relationships that we have with our parents. Again, this is roles and responsibilities for nursery staff. Now more than ever, it's important that we do ensure that we have in place strong relationships with the parents and families that we work with and good open communication. And we need to be mindful now of the fact that communicating with parents and building those relationships is going to be a whole new challenge, because we're not going to see parents. Parents will be dropping children at the door of the nursery, and there's every chance that we'll have a runner that will bring that child from the nursery door to our classroom doors. So the opportunity to see parents will be significantly reduced. So within your nurseries, think about how you're going to initiate those relationships with the new parents that you have, and then how you're going to maintain them. In the coming weeks, you might want to think about contacting them individually to find out about what the experiences that they've had during COVID have been, so you have an understanding of the children that are coming into your setting. You might want to do things like some storytelling sessions so the children get used to seeing your face. All of these online methods, again, just for transitioning the children in. Parents are also quite keen to see what the classrooms look like at the moment. So again, giving them a quick online tour of what your room looks like and all the different things the children can look forward to once you've reopened is another way of reassuring parents. Something also to be mindful of at the moment is that the children that are returning to our settings are not going to be the same as the children who left us in March this year. We know that, again, children have had lots of different experiences of COVID, and some of them have had more challenging times than others. So we need to take time to understand the children that are coming into us. It's important now as well that we take time to understand their likes and dislikes, again, so that we can support them in those first few weeks, and making sure that as much as possible we make that transition as stress-free for everybody as we can. Another suggestion for you perhaps is to send home, you could email over to them a photo of you and make a mini teacher, so that over the next week or two before we reopen, the child can take you everywhere, and perhaps build a photo diary that can be sent to you by email. As much as possible, we do need to go paperless, so sending things in by email is a good option here. Again, it's just a way of getting conversations started about coming to school and about who you are and the role that you're going to have in their lives moving forward. We're also, as I say, going to have limited opportunities in the weeks and months ahead, possibly, for meeting those parents. So perhaps build into your next few weeks and months some opportunities online to meet with parents and find out how their child has transitioned and what that settling in process has been like for them. Getting updates and having that conversation with them may again just help alleviate some of the stress that everybody's feeling. Moving forward, more than ever, it is all about communication, 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 and finding ways that you can have in place good communication methods to support and understand the parents, but also to support those children that you have, and making sure that you're accessible, but in new and different ways. So while I say that communication is really, really important, I'm also a big believer that it's important that we have boundaries in place. We need to make sure that parents are aware that when you are teaching and you've got that contact time with children, you won't be as contactable, just because your focus is on those children. But again, making sure that they understand that you will respond to them as quickly as you can, but obviously highlighting the importance of your time with the children, because that's ultimately where our importance lies. I would also say to them at the moment, having boundaries with regards to times when they can contact you, and methods of contacting you. What you don't want is people trying to hunt you down on Facebook. So again, putting in place that they have your email address and you are contactable at any time of the day. When you're in class, obviously you won't respond so quickly, but you will get back to them as quickly as you can. And establishing beforehand the expectations on communication. So again, if you have a nursery app or you're going to be communicating with email, how regularly will you be doing that? Keeping in mind all of the other measures that you now have within your setting and within your bubble, things that you have to make sure that you've covered, health and hygiene, all the different bits and pieces that we will now have to be covering in a day. Again, is it reasonable to expect you to send something every day for every child, or will you do a roundup at the end of the week? Will you send something every other day? What will be the expectation they can have of you that is reasonable and fair and that you can live up to? So again, setting that out from the beginning so that you're not feeling overwhelmed. There's lots and lots of communication technology out there. Again, make sure they understand how you will be communicating with them so they know where to look for information from you. And take time to recognize that the next few weeks, it's going to take us time to settle into this new routine and this new normal. So again, making sure that you are planning ahead and that you're not expecting everything to work straight away. It will take a little bit of time to get all of this new routine in place and be able to work with it. Moving forward as well, you also need to think about how we will be sending home work. We've talked about not being able to send hard copies of work home. So again, how regularly will you send photos or examples of things that they've done as a soft copy so that they're aware? And again, just having that clear expectation moving forward of what they can expect. Again, it might be something that as a whole nursery team you decide together, or it might be, again, based on what your leadership says, something that you decide on a bubble by bubble basis. Again, work through it and identify what you'll be doing. Guideline number 8, there's responsibilities here for the nursery staff and for the nurse. So within our nursery, vulnerable populations are defined as people who have any physical or medical disabilities and needs, people who have weakened immune systems due to chronic illness, and this includes heart disease, hypertension, diabetes, chronic respiratory disease, and cancer, or anybody that has a compromised immune system from medical conditions or treatments such as chemotherapy. So again, these are people that we need to identify. It might be that perhaps your staff has a member of your staff has a chronic illness, or one of the children, or indeed perhaps one of their family members. And this is again why we're asking about living arrangements, and we're getting that understanding. Perhaps they live with somebody that's elderly, and that's at the moment being classed as somebody over 60. It's important that as a nursery you're aware of this, and that again you're able to plan and support people. It is important that if you do have a pre-existing medical condition, it is your responsibility to notify your school nurse and your school leadership of this. And then this just allows them to have a think about the support that they can put in place for you. If you are somebody that's classed as at risk, it may be that a doctor can provide a letter stating whether you are fit to be in the setting at the moment. So again, are you able to work currently with your medical condition within the nursery environment? And again, alternative roles may be provided if the setting leadership determine that that's necessary. And again, with the children, what kind of support could you put in place? So looking at this, if you find a child that is at risk, they shouldn't be enrolled in the nursery. So how can you support them then? Are you able to offer online learning so that they can still learn but from their homes? Again, if you have a child that is classed as vulnerable, it may be a case that you can request that a doctor provide a doctor's letter if they feel it's fit to do so. Again, that child is able to attend, and this would just need to be kept on their file. So the same for a staff member. If the doctor does issue a letter and says that they are fit to be in the nursery environment, that just needs to be kept in their staff or child record on file. And last but not least, guideline number 9. So this is about well-being. And as we've already said, COVID-19 has meant something different to everybody. Perhaps there's been a death in the family, or perhaps children have witnessed, or staff have witnessed, people that have been really unwell with COVID. Many of us are missing our family overseas. I think I talk for a lot of us there. We are missing our family significantly. Some people have either themselves experienced redundancy or have had a family member that has experienced it. We're hearing as well at the moment that some families are experiencing divorces. And children may have lost a lot of time that they could have had with parents. Parents have been working and they may not have had the time for their children that they would normally have. So again, there's a lot of that time that's been lost there. And we're also hearing as well that some children have lost the nannies or people that are familiar to them. Again, perhaps through redundancy, there hasn't been enough money, so they've had to let their caregivers go. So again, it's meant something different. So taking time to understand what this means for the children in your bubble is really, really important. I mentioned a short while ago, thinking of having those one-to-one video calls, again, to take time to introduce yourself as a bubble team, and finding out what COVID has meant for each of the families that are coming into your care. And again, taking time to note all of the information and getting to know a little bit more about the children and the families that you're going to be working with. I talked as well about giving tours of your classroom online to, again, reassure parents. And it also is quite a nice conversation starter, because as they see the room, they'll see areas that their children may really, really enjoy, or things that they're really excited about. And it gives them an idea of the conversations that they can have with their children prior to the children returning to nursery. Also take it as an opportunity to highlight to them any items that they're going to need. We talk in part 1 about the importance of each child having their own cubby, and that their cubbies shouldn't be overflowing with items. So again, take time to outline to parents exactly the requirements that their child will have each day, and make sure that they only bring those items to school with them. And once the children are in our care, it's going to be important that we do start to look at talking to them about the feelings that they've had, and again looking at the experiences that they've had and having conversations with them moving forward. We know that the first few weeks is going to be a slow transition, so take time. Don't race straight into a full-on curriculum program. If you're able to, build in a couple of weeks there, just to make sure you're transitioning those children into the nursery, and that they're having lots and lots of really good learning opportunities and experience that they're enjoying, and supporting that transition process. At the moment, in coordination with what we're doing in training the nursery teachers, the Early Childhood Authority is also doing a number of sessions on well-being and transitioning. So again, just take time to look at the Early Childhood Authority's website, and there are a number of free online workshops there being offered that you're able to attend. So take advantage of opportunities like that as well. It is important as well, in an age and stage appropriate manner, obviously, that if we're working with older children, we do have conversations with parents about supporting independence of those children, and making sure that they are, as much as possible, trying to self-feed, that they're trying to toilet themselves, and obviously also washing their hands. Obviously we'll supervise them doing this, but promoting that independence is a good way, again, of minimizing the spread of COVID-19. So again, let's be very clear, and let's have that partnership with our parents, and make sure that we're working together to make those children, in an age and stage appropriate manner, as independent as possible. Okay, so this concludes part 2 of the training. Congratulations if you've done part 1 and part 2 now. I know that some people are doing part 2 before part 1 because of the way they've booked their sessions. On completion of this, you will now get that code. It's a unique code to you, so please don't share it with other people, for you to complete your assessment. And it's important that you do complete that assessment, because copies of the certificates will be required as part of the reopening process. It's important for me to also tell you that you are able to attempt the test as many times as you would like to complete it. But if you do it a couple of times and again you're not getting that 100%, do please go back to the Kindersley website, listen to the sessions again, read through the guidelines again before completing it again, because you really do need to know this information, and you do need to have a good understanding of what the guidelines are saying and your roles and responsibilities within it. And as I mentioned at the beginning of the session, there will be translated versions in Hindi and Tagalog, if that makes it easier for some people in understanding what we're saying and the guidelines themselves. So those will be available. It usually takes 24 hours from when a session has been delivered for the session to be uploaded to the Kindersley website. So some final reminders really from me. If you have had your hand up, I would just like to say again, I'm really sorry. We are not allowed to take live questions. All of your questions do need to go to the licensing authority for answering. So at the top of your screen, you'll see that there is a button that says Q&A. If you have a question, do please type it in there. And again, before you write your question, just write down the name of the licensing authority that you fall under. And we'll just put all of those questions to the licensing authorities, and they will be asked to provide us with a response. Once we have those responses, we do then upload them onto the Kindersley website. There is a page there that's frequently asked questions, FAQs, and that's broken into the different areas. So you'll be able to go and scan through it and find exactly what you're looking for. When I say to you it's regularly updated, it is updated daily with the updates from the different licensing authorities. And as I say, it really is important. They do all have slightly different interpretations of some of the areas. So it really is important that we get your question to your right licensing authority. So on behalf of myself, I would like to say thank you so much for attending this evening's session. A big thank you to the Early Childhood Authority, the ECA, and your licensing authorities, the Ministry of Education, ADEC and SPEAR, for putting on the training. And I wish everybody a good evening. I will leave the chat function live for the next few minutes. So if there's any questions you wish to put, you can put them up there now. Thank you so much for joining me, and I wish you every success in the reopening of your nursery.